IoT is a major force that is changing the way healthcare is delivered in India today. This fast-changing scenario is explained by Ravi Ramaswamy, Senior Director and Head, Health Systems, Philips Innovation Campus and Chair, Healthcare Working Group, IET IoT Panel.
If you really look at the challenges that we are faced with today, it is around cost, quality and access. The question is, India simply does not have the resources that it takes to invest to get all the basic macroeconomic factors up to where the world ought to be. Given that you have limited options there, we are trying to see how we can use IoT and AI as a combination to see how we can deliver healthcare and decentralize it to the extent that the same quality of care is available even at the remote site.
The challenges we face need IoT to reach global levels of efficiency in this sector. Some solutions sound too good to be true.
There could be certain examples that we can talk about. For example, mobile obstetrics monitoring. What we actually do here, we know what the challenges are. The challenge is neonatal and maternal mortality is extremely high. All of us know about it. The question is there a way that an ASHA worker can actually monitor the vital parameters of a lady and the baby, and over a period of time do a certain amount of triangulation on that and then come up with predictive models which basically stratify the risk that the mother faces and therefore move her to an appropriate point in care. If it is a normal, it could be handled at a primary health center. If it is a traumatic pregnancy, if that is what is going to be expected, and we should be able to sort of take her to a secondary or a tertiary nursing care facility so that the pregnancy is managed well and both the mother and the baby are safe. Now, there could be multiple ways by which it is done. Like for example, we did a study in Shorapur in Karnataka along with a leading hospital, and we found that cases of anemia and cases of traumatic pregnancies or high-risk pregnancies could be identified well in advance, even before it manifests itself in a manner that could be life-threatening. So, and AI has a significant role to play there. That is one. Take the case of ICCC, that is consultative critical care. We know for sure that that in an ICU, you find it more located in the big hospitals in the cities and not as much in the rural outreach of the country. So is there a way that you can have an intensivist from a hub oversee and guide the physician, the caregiver in the spoke, so that the standard of care is maintained as to what you would have got in a tertiary, but the care is actually dispensed in a primary state. We call this product as consultative critical care. It's up and running in India. We have got a fairly high triple-digit numbers operating as we speak, and we have seen significant results. And we all know that intensivist managed care drives down the death rate in an ICU significantly better than what an anesthetist or a general physician actually manages. The third example could be in terms of TB screening. If I take a country in the Middle East where management of immigrant workers or scanning for immigrant workers for TB is an absolute must, we have got algorithms which run on 1 million images to learn it, and then you are able to differentiate between a TB and a non-TB case to a fair degree of accuracy, over upwards of 95%, by virtue of which you are enhancing the productivity of the doctor almost by 25-30%, and then you are also able to stratify the cases so that the doctor first looks at all the high priority cases when his mind is fresh, and therefore the outcomes are far, far better. There could be enough and more applications around it. Semantic search is another area which can bring in significant benefits in terms of looking at records and looking for synonyms and then trying to sort of group them together in a timeline. So, role of analytics and adaptive intelligence is there to stay. Philips is invested into it big time. We have what is called as the Health Suite Insights, which is a platform for managing analytics and insights, and coupled with deep learning and machine learning, I think that's the way to go in from a cost management and from a outcome management perspective.
As Rishi Mohan Bhatnagar, Chairman, IET India Panel and IoT India Congress, President, Aeris Communications says, IoT's special touch is to ensure that quality healthcare can be provided for rural areas.
What has happened is in India, if you see 70% of our population live in the rural area and 75% of the paramedical trained staff live in the urban area. Okay, So if we really want to provide services, healthcare services to the whole, all Indians, okay, we need to provide services on the doorsteps of the villagers, okay. And for that, we might require 2.5 million more doctors and 3.5 million more paramedical staff, which is not possible. So here, the remote patient monitoring, where the child and mother care centers which are there in the villages and the Gram Panchayat, which are now connected with the the optical fiber due to BharatNet, have been trained to use the standard devices which they can fit on the patient and can tell on spot that whether you are required to go to the doctor in the hospital or not. Okay. And that all the data coming from these devices put into the villages through internet, coming to the cloud, where the doctor can assess from anywhere in the world, saying that yes, you are required to come to the hospital or not, will reduce 40 to 50% of unnecessary travel of people from villages to the urban areas. Okay. That to me is one of the good innovation that will help the mankind. Otherwise, there are many things which has happened on the child and mother care or the old age. So you can predict the fall, you can predict the heart attack, you can do multiple things, because one is the IoT device where it is collecting data, and after that data, how can you do analytics and see and predict things, and that becomes more important. And that is the real innovation that will keep on coming. Now the data has been collected, now more innovations will start coming.
Going beyond generic healthcare apps, even the enterprise in the sector is now adept at using these innovations.
So the hospitals have started using these kind of devices. In the healthcare industry, the hospitals were already advanced. Today we can see people are trying to do neurosurgery using Internet of Things from remote locations. Okay. So doctor is not required to travel kilometers, or he or she can be anywhere in the world and do an operation connecting the IoT devices. And that's one of the innovation that is happening. But still I consider the remote patient monitoring in the rural area to be a bigger innovation, because that will impact many more people in the world than the neurosurgery.